prognosis of patients with primary osteosarcoma who have undergone unplanned therapy by Dr. Lee.
Good morning, ladies and gentlemen. It's my honor today to present here the topics about osteosarcoma after unplanned treatment. I come from Taiwan, Taipei, home of HTC. We know the guidelines to treat osteosarcoma include chemotherapy and surgical excision. Since 1970s, neoadjuvant chemotherapy was enrolled to the treatment, and it played a very important role. And for surgery, what we have to do is excise the tumor widely instead of curettage. But sometimes patient and doctors are not so likely to follow this guideline, the so-called unplanned treatment or the Boop syndrome. The purpose of this study is to compare the prognosis of patients with osteosarcoma who had received unplanned treatment with those who received planned treatment. The patients were divided into two groups. Group of planned treatment were treated by neoadjuvant chemotherapy first, and followed by wide excision and adjuvant chemotherapy. And group of unplanned treatment were misdiagnosed first and received unplanned surgery. This figure shows our protocol of neoadjuvant chemotherapy. Higher dose of adriamycin and cisplatin were in unplanned group. Result: the mean age was 10 years older in unplanned group, and both the initial tumor largest dimension and tumor volume were smaller in unplanned group. Lung metastasis rate was no significant difference between both groups. The time of metastasis was earlier in planned group. The local recurrence rate was higher in unplanned group, and the limb salvage rate was lower in unplanned group. The 5-year survival rate was no significant difference between both groups. Here we present two cases. The first case is 40 years old male. He suffered from left femur painful disability after minor trauma. He was initially being treated a simple fracture by open reduction and internal fixation. You can see 4 months later, and also leaf lesion over the surgical site. So the non-union was suspected by his doctor, and he received another surgery. And you can see the lesion getting progressed. So after biopsy-proof osteosarcoma, then the patient received neoadjuvant chemotherapy. We excise the whole femur and reconstruct with total femur prosthesis. Currently, he is disease-free. The second case is a 10-year-old boy. He suffered from left upper limb painful without any trauma. He was initially being treated as aneurysm bone cyst by curettage and internal fixation. And we see 5 months later, the lesion getting progressed. So we perform shoulder disarticulation immediately, and the pathology showed telangiectatic osteosarcoma. Sadly, he expired 14 months later. Discussion 1: what caused unplanned treatment? Unplanned treatment cause. The first cause is relative old age. We know osteosarcoma was commonly occurring in teenagers. So in a relative older patient with bone disease, osteosarcoma might not be first impression. Patients are never too old to get osteosarcoma. The second cause is a relative small tumor size. We can see the 3 plain film below. A relatively small lesion may lead to misdiagnosis as benign bone tumor. Discussion 2: what unplanned treatment cause? Unplanned treatment may cause higher local recurrence rate and subsequently lower limb salvage rate. It might be because those patients didn't receive neoadjuvant chemotherapy. And during the unplanned surgery, the poorly oriented incision, the inadequate surgical margin, and the wrong joint position may increase local tumor seeding. And unplanned treatment also causes early lung metastasis. It's in earlier systemic spreading. But in our study, unplanned treatment will not cause higher lung metastasis rate or poor outcome. It may be because the initial tumor size was small, or the higher dosage of chemotherapy in unplanned group, or the small sample size in our study. So our conclusion is for patients who receive unplanned treatment for osteosarcoma, having a lack of neoadjuvant chemotherapy and unplanned surgery can result in failure of local control and earlier systemic tumor metastasis. So we have to pay more attention to this situation. Thank you.
go over it, there are a few burning questions. I do have one commentary. I'm not sure it's fair to lump